Welcome to Bodcast, the Business of Dentistry podcast, brought to you by Practice Plan. Bodcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hi, and welcome to Bodcast. I'm Laura from Practice Plan, and today I'm joined by Hannah Greaves. Nice to meet you today, Hannah.
Nice to meet you, Laura. Yeah, I'm good, thank you. Yeah, very good.
And today we're just going to chat about career paths for dental nurses.
Yeah.
So to start us off, do you just want to give yourself a brief introduction and kind of your career path and how you've led to this role that you're in currently?
Absolutely. So I started in dentistry in 2006, I believe. So a little while ago now. I think it's been about 18 years. And I started off as a trainee dental nurse, no experience in dentistry, no particular interest in dentistry, if I'm completely honest. I don't think dental nursing is something that people are wanting to go into. I don't think it's something that a lot of people think about as a career opportunity. So I think majority of dental nurses that I know, you kind of fall into it. It's something that just crops up and you think, yeah, I'll give that a go, and you really enjoy it. I always had an interest in healthcare, so I think that sort of setting was always something that I was interested in. So when the opportunity became available, I started in practice. I did my qualification and registered with the GDC within a couple of years. And then I started training the dental nurses that came through the doors, the new dental nurses. And that's probably where I really found my passion in learning development and training, developing people. For me, the most job satisfaction I get is from training and developing someone and seeing them flourish in their own career. So for me, that's always been, that's sort of where I really discovered that passion. I then went into a role of patient care trainer for the area. So our small little private practices got taken over by corporate, which is, to everyone, is quite scary because you don't know what's to come. It's like the unknown. You hear all these things about corporates and it being, really bad, but it isn't. And I think until you're in that setting, you don't really realise actually there's so many more opportunities in corporate because you've got so much more of like a management places to go and places to develop in. There's practice managers, area managers, directors of region, treatment coordinators. There's so many different things within a corporate that you can develop into. So I did the role of patient care trainer for about 6 months, and then the practice manager of the original sites decided that it wasn't for her, and she retired. And then I was offered to interview for practice manager for the sites that I started off in. So obviously I thought, I can't do this, no way. So I researched the role. I made friends with some of the other practice managers in the corporate group, and they really supported me to be prepared for the interview, and I got that role. So that's when I started as a practice manager, and I did that for about 1.5 years before relocating to the sunny northeast of England. So sunny, rainy, and I started my journey with my dentist there. So I started as a dual site practice manager for my dentist for 2 sites in Teesside. I did that for a while until I got that feeling of, when you wake up and you don't want to go to work and you just think, I don't really want to do this anymore. I've had enough. It's time to move forward. And I think I've always had that want to move forward, and it just got to a point where it wasn't for me anymore. I loved the people management, but the admin-y side of things just wasn't for me. So a role became available for a student dental nurse trainer for the North East of Scotland. So I went for that, and that's when I moved into the L&D team.
Brilliant.
So I've been in the L&D team now since 2016, I believe. I've done a few roles within that. I've qualified as a learning development practitioner, and I now run our in-house student dental nurse programme. So we have over 1,000 students at any one time on the programme, so it's a big job, and we support them through their diploma. And then I also deal with development for qualified dental nurses. So once they qualify and want to go into different career pathways, that's where I come in and support them with that.
Great, sounds fantastic. So what do you feel are the main areas, the challenges that dental nurses face?
I think depending on where you are working, I think sometimes there isn't that room for progression where you are. and sometimes you kind of have to think outside of those four walls of the practice you're in, because sometimes as a dental nurse you can get quite complacent. You know, if it's a practice down the road, you know everybody, you know your patients, you're friends with everyone you work with, it's a lovely setting, but there's no room for progression. There's nothing else you can move into. They don't do specialisms perhaps, or there's not like a management structure that you can move into. I think that is a real barrier for some nurses, and it's breaking through that and seeing like that there are other opportunities. Sometimes you have to move forward, and if you've been somewhere a long time and you're comfortable, it's getting out of your comfort zone and trying something different and having the confidence to be able to move into maybe a bigger site or a corporate or whatever it is that offers more opportunities, and it might be a bit of a commute. That's another barrier that a lot of nurses face, or it might be longer working hours, and depending on your personal circumstances, if you can do it and you're going to move forward and that's what you want to do, then you need to just go for it.
So if you were starting out as a dental nurse, what kind of advice would you give to people who are looking to kind of climb the ladder and progress?
I'd say the first thing is get your qualification and registered with the GDC. I think you want to look forward, and it's great that people have that vision of, I want to be here, I want to be there. I think the first thing you need to do is take a step back, get your initial qualification, learn the role, and get registered with the General Dental Council. So you're a registered body, you're in that role, and then start to think about where you want to go. So once you've got that nailed, it's then, right, what's next? And I think it's not thinking too far ahead. I think just think about what's the next thing you want to try. And sometimes you'll try roles and they're not for you. So I think I know dental nurses that have gone into the clinical route, where they've gone into specialisms, so they've qualified in sedation, implant nursing, work in max fax units in hospitals, and that's what they want to do. They want to work chairside practically and expand their clinical knowledge and qualifications, and that's great. And then you get some nurses that want to go down the practice manager, area manager, even sales. You know, there's so many areas that they can go in that are necessarily like non-clinical roles, or you can mix it up. So a lot of people don't think of that, but my career has been very much clinical and non-clinical, and a balance of the two. So I think the advice I'd give about wanting to progress is be really open to opportunities and try things, because the best thing you can do is, once you've got that qualification and you're registered with the GDC, you can always go back to dental nursing, and there is nothing wrong with going back. Things happen in your life, like if you have children and you might want to go back part-time for a period of time, it's okay you'll find a job. You know, everyone's crying out for dental nurses, and it is a great job to do, and it doesn't matter if you take a step back and then a couple of years later you think, right, now I'm ready to move forward. So it's not a race, what I would say. And it's taken me 18 years. It's a long period of time, and it's nice to do that slow transition. Just don't sort of try and go too far ahead.
Yeah. Okay. Brilliant. So my last question, you kind of touched upon it slightly already. So what do you feel like the key opportunities and pathways are that's available for dental nurses?
So I think definitely clinical route, non-clinical route, mix of the two. There's a lot of different jobs that you wouldn't even think of, but actually might be right for you. So I know dental nurses that have gone into sales, and they've gone and worked for really reputable big companies, and sold products, and gone and done lunch and learns, and they've done training sessions within that. So there is different opportunities. It's just to keep an open mind. For me, I think a lot of nurses want to do that clinical route, and that's great. And you know, you could go into hygiene therapy, and you could really push it, and you could become a practitioner, and that's great to become a clinician from being a dental nurse. But I think there's just so many opportunities that you don't even think of. And I think once you start opening those doors, things will should just sort of come naturally, and you'll navigate where you want to be and where you want your pathway to go by trying new things. And even if you end up in a role and you think this isn't for me, it might be that, yeah, you didn't enjoy that role, but if you hadn't have done it, it wouldn't have opened the opportunity for another possibility that's to come. So So there's so many avenues that it's not really spoke about, and at the minute I'm working on a big piece around career pathways, because I want dental nurses to qualify, register, and then just have the opportunity to sit down and think, right, where do I want my career to go, and have a clear vision of where that's going to go and what direction you can go in, and just open up the possibilities of all these different opportunities that could be out there for them.
Brilliant. Okay, so that's some great advice there. So it has been lovely chatting to you, Hannah. Are there any final words that you want to?
I think all I would say is, and this is probably what I did, which really helped me, was networking and connecting with people. So the brilliance of having like LinkedIn and things like that we've got in this day and age is great, because find people that inspire you and are in roles that you want to be in, and don't be afraid to reach out to people, because a lot of people do want to help. And when dental nurses come to me and ask for advice and want some support, I'm all ears, and I'll do everything I can to support them, because I think people that have been in your position and done your role before are always there to help. And just don't be afraid to reach out to people and connect with people, and build those relationships, because I think that's having those people around you and supportive people around you is the key to sort of motivating yourself.
Absolutely. Fantastic. Okay, brilliant. Thank you for your time.
Thank you very much.
Speak to you soon.
Bye.
Bye.